Hello and welcome back to the channel. Good to have you here with me today. So as usual, this is my invitation as I say thank you for engaging with the channel, as you're subscribing, as you are liking, commenting, sharing the videos, asking questions, all the things. I thank you very much for that. As you go along this journey of my 2025 urinary health journey, I really do appreciate you being here today. So I'm going to get right into it, but as per usual, I always put my full disclaimer in the description and any vital links that gives you more information that I think may be helpful to you as if you're on your own research journey. I am not a medical professional. That's it. That's all. I'm not a doctor. So in the last video, so today's video, I'm going to talk about my decision that I made of what my doctor suggested in the last video for the next steps. So in the last video, I provided information regarding the non-atypical hypoplasia condition, which my doctor determined after the histoscopy procedure. So my doctor provided me with, based off of that, two basically saying that I should take progesterone. And she gave me two different ways that I can take progesterone. I can take it orally via a pill or have an IUD placed in the uterus. So we went ahead before we ended that conversation, that meeting, is that we went ahead and I made an appointment, so that if I did, go for the IUD, which is a procedure which would have to be done in her office, we would already have that scheduled. If I sent her a message via the patient portal that I did not want to go that route, we would at least have an appointment and we would just cut it short and we could just go over what happens when you take it orally. Okay. So that was that. So I'm looking at my notes because I need to make sure I get all this right. So of course, I did my research on both. So for me personally, one of the pros for taking it orally is I'm pretty disciplined. I already take vitamins in the morning. So I figure maybe that might be the route to go, to take that in the morning as I'm taking my vitamins. My doctor said it was okay, long as I take the progesterone every day at the same time, around the same time. So I said, that's fine. One of the benefits to having the IUD just placed in the uterus is it's right there on the uterus. I don't have to think about it. It's there. It can be in there, I guess, 5 years or more, if not longer, maybe even up to 8, I think she said. So it can be there a little while longer. So I never have to think about it. As you take the oral form, it does go through your whole body. It gets into your system. When I think with the IUD, because it's placed right there in the uterus, it's right there with the uterine wall. I don't know if it's more aggressive that way, but it still gets into your system. But I just wanted to, explain to you that way. Okay. So of course I did the benefits, the side effects of both of them, right? So if I take the oral form, which is the pill, which would be the I can never say this, medroxyprogesterone 10 milligrams, which is the lowest dosage. One of the things that it can do, that's why I told you to make sure you put in postmenopausal, because if you just put in regularly, and I made sure I put these notes here, it starts telling you about your menstrual cycles and things of that nature, but you're postmenopausal, so that doesn't apply to me. But what does apply to me is that it treats irregular or heavy uterine bleeding that may be caused by hormonal imbalance. Everybody has a different phase. Everybody has a different, we're all different. So my symptoms dealing with this might be different from yours. So it just, taking this progesterone will be able to, manage that. It said it protects the uterus when take alongside. Sometimes people take this alongside with estrogen. It helps prevent excessive thickening of the uterine lining. Since I already have something's telling my body to produce more estrogen, so by taking the progesterone, this will be working in tangent, and like it says here, to prevent excessive thickening of the uterine wall, and it reduces the risk of uterine cancer, which I love all of those things. So sometimes, depending on your stage, it can treat your endometriosis. And it can also manages your PCOS symptoms as well, which is polycystic ovary syndrome. I don't believe I have that. So yes. So those were, the benefits of just taking the progesterone, period. So when you take the pill, the common side effects are these. I could have irregular bleeding. I can have headaches, often migraines, but that can be managed with over the counter, drugs. Should I say drugs, pills, medicine? I could have nausea, stomach pain. I could have breast tenderness or pain. I could be fatigued and tired. I could have weight changes. I could gain weight or lose weight, and my appetite could increase. I could have mood changes, which would include anxiety and depression. I could have hair or skin changes like acne, hair loss, or hairiness. So those are some of the side effects of taking the pill form, the oral form. So some of the things that, and then if it gets really serious, you can have like a blood clot, stroke, heart attack, liver issues, allergic reaction, and other things. When it gets to be that, something like that, you definitely should stop and call your doctor and say, this medication isn't working for me. But as I'm listening to all of these side effects, I think about the commercials I used to see with people running through the field because I guess they're happy that they have their medicine to make them feel better and bring healing towards their body. But then there's always that voice that would come and say, don't take this, blah, blah, blah. And the side effects and you're just like, whoa, that's how I feel about this too. So, and then, there's always long-term risk whenever you're taking any kind of medication. So no matter what medication you're taking, if you don't feel like it's working for you, please stop it, and, just maybe they need to lower the dosage. Maybe they need to change things because what's one for one person is not one for, it's not good for the other person. Right. So let's get into the side effects of the IUD. You could have irregular spotting like the first 3 to 6 months. You could have what is this saying? You could have moody feelings and things of that nature. You could have acne, breast soreness. You could have like mild cramping and discomfort and some kind of discomfort, immediately after the insertion. Because remember, this is a procedure for the IUD that she has to go in and she places it in. She says it's not more than a 30. You wouldn't be. The appointment's for 30 minutes, but you wouldn't be in there 30 minutes, and you should be able to go home and be fine. But if you think that you have a high tolerance or low tolerance, ask them to prescribe you something or, what you could take for that. Nobody wants to be in any more pain. That's what I say. And then I was reading in this that sometimes the IUD can slip out as well. So that's a side effect for it. I don't know if you see it when it slips out or if you know it slips out. So it could slip out as well. So those are some of the side effects for taking the IUD. So for me, after, careful consideration and looking at all of the pros and the cons, and then, I really went into prayer and I just, I always try to take the route that seems most peaceful for me and that's more doable for me. So I decided to go with the oral pill form of the progesterone. I thought that would be the better choice. Did the sun change? The lighting change? Looks like the sun changed. Okay. Hopefully you can still see me though. And so I'm a little disciplined, like I said earlier. So I do believe that I would take it every day at the same time. So I think that I would be okay. And then the good thing about it is when I talked to my doctor, she said that if I didn't feel like I was being disciplined enough with the pill, I could make the appointment and change and have the IUD inserted instead. So I figured I can always, it's more of like going up system instead of going down. Or who knows, maybe if I would have chose the IUD was discomfort, maybe I would have gone to the pills. I don't know, but I think you just have to really think what's best for you and just to make sure that whatever you do, it does bring healing towards you and towards your body. This was the first time me being on any kind of medication for a long period of time. So I just didn't know what to expect. So she was very good at answering all of my questions about this. And what she did was she said I could be on this a long duration. We're going to test it and see. But she did prescribe at each 3 months. So I had 90 pills to take. So every 3 months I'd be getting a renewed prescription, and I had 4 refills. December, and we scheduled my next biopsy for December 2025 to check the status, to see how the progesterone is working and how my body's adapting to it, and prayerfully that it is really managing the growth of the uterine lining. And my thing, she says manage, I say shrink in the name of Jesus. That's what I say. That's what she says. So I know she's a doctor. She can't say shrink and it doesn't shrink. So she has to say manage, being politically correct in the place. So I wanted to show you what it looked like. Okay, so you can see what it looks like. I have it here. It's this tiny. Can you see it? It's so tiny. And yeah, it's so tiny. It's smaller than a M&M. So, and then you can see it has numbers on it and everything like that. So I wanted to at least let you see how small it is. So you don't really have to take it with water, but it's easy peasy. Pop it in and, take your medicine. So of course, because I talked to you guys about research, when I went to pick up my prescription, the bottle, I have it here. When I went to pick up my prescription, I got the prescription before I left. I made sure it was me and what it was supposed to be inside. And then once I got in the car, you know how on your phone you can take a picture of something and it'll tell you what it is. So I took the pill out, and there's a number on one side and I think a symbol on the other. I took a picture of that to make sure it was what it was. So it did come up the progesterone, and it did come up with the milligrams, 10 milligrams, because pharmacists are people too, and you do hear those. I was out in the grass. You do hear those stories about somebody got the wrong thing. Mistakes happen. I just wanted to make sure before I left the parking lot that it was what it was. And I think we should all do the same. It's better to be safe than sorry. So that was the first thing I did, because then again, I said, this is my first time taking it. I've heard horror stories, so I just wanted to make sure. So it came up exactly what it was supposed to do. And the second thing I did, and I learned this from my sister, is that I brought all of the side effects on a sheet of paper, or maybe I might have had it on my phone, I'm not sure. And so right then and there, I had the bottle in my hand, and I just started praying against any kind of side effects having any kind of effect on my body now or even in the future. So I called out each and every one, right? I just wanted to make sure. So that was something that I did do. So I just wanted to take this time to tell you what my decision was. One of the things I can say that happened after taking it, like a couple of days, I did see spotting of blood, which was one of the side effects. I have had some breast tenderness, but that came much later. When it comes to headaches, I think I've had maybe 1 or 2 migraine headaches, and I know because I used to suffer greatly from migraine headaches to the point that I would have to be in a room that was dark and put a cold towel over my eyes. I thank the Lord Jesus Christ that I've been delivered from all of that, and I don't no longer suffer from any of that. But I did used to get bad, pretty bad migraines. Hormonal, your mood swings going up and down. That could be, it's part of menopause, so who knows? Anytime I feel any kind of anxiety or like a sadness about anything, I always try to start praying to, immediately change that around, because there's so many things happening in 2020. There were so many things happening in 2025, and now we're in 2026. So I definitely try to, take in so much. We've had just one thing after the other, whether it's something within your family, within the workplace, within, your community that you live in, or the news or whatever. It's a lot. Okay, now it's back. Hi there. I'm back. So I just wanted to let you know what I decided to do. And so far, it's been working very well for me. I'm trying to think. I don't think I've missed taking it. If maybe one day I have, because running around, running outside the door, but I've been pretty faithful to taking it and taking it every day. So when the next video, when I talk about my journey, I will talk about my December 2025 appointment biopsy, and then the results from the biopsy. So literally, you can see this has really gone for a whole year. January was bleeding, the spotting of the blood, which was the first thing. And then, then I go see my doctor. Then March, I have an ultrasound. Then March, I meet my new gynae, which I have my first biopsy. Then I go to June and have an ultrasound. July, I have an ultrasound. August, I have the hysteroscopy, excuse me. Then like September, I start taking the progesterone, and now waiting a couple of months to get my next biopsy. So it was a really a long all year. So when I say my journey was 2025 was the entire year, it literally was the entire year. And I probably should do something on the state of my mind at that moment, because you just, yeah. the state of my mind. So anyway, I hope this video has been very informative to you. If you have any questions, please feel free to ask. I don't mind. I'm trying to put as much information out there and be as transparent as possible so that someone that runs across this video sees a actual person that went through this. I appreciate all the doctors, of course, providing all of their medical advice via the social media. But I just think it's sometimes to hear from people and not always the high level stuff, but for us to really break down and say what happened to us and how we're feeling and things of that nature. So until next time, I hope you have a fantastic day. And remember, if you're feeling any sort of pain, please go see your doctor. If you're on any medication and you don't think it's working for you, please call your doctor. Advocate for yourself. You are the only person that knows exactly what you're feeling. They're going to tell you, oh, custom says, oh, yeah, we've been through this case. So customarily it's this, this, and that. But that may not be your case. You might be the 1 in 1,000 and something in yours is very different. So advocate for yourself. And if you don't think you're getting the care you need, look for better care. Okay? Take care and have a great day.